The Beginner's Guide to Ketamine for Mental Health by Leah Benson, LMHC, EDM. And I'm Leah Benson.
Forward. I am Qazi Zain Hassan, Chief Medical Officer and co-founder of New Life Health, November 2022. Ketamine, a near-perfect anesthetic. Its safety profile on the respiratory and cardiovascular systems, plus its analgesic, pain-relieving properties, have made ketamine the most commonly used anesthetic in the world. Through the serendipity of science and medicine, ketamine's rapid-acting antidepressant effects were discovered. Ketamine's journey from synthesis as an anesthetic in 1962 to its first randomized double-blinded clinical trial for depression took about 38 years. It proved successful in helping a population of patients who had failed multiple prior medications. Treatment-resistant, these patients are called. Now, dozens of randomized double-blinded controlled trials have unequivocally demonstrated ketamine's power as an antidepressant, and several studies speak to its anxiolytic, anxiety-relieving properties. Presently, Yale Department of Psychiatry touts the medicine as the biggest breakthrough in psychiatry in the past 50 years, which speaks to the incredible evolution of a chemical first described as a dissociative anesthetic, today contentiously classified as a true psychedelic. As the current psychedelic renaissance began to unfold in the early 2000s, IV ketamine clinics emerged alongside efforts by nonprofits like the Multidisciplinary Association for Psychedelic Studies, MAPS. MAPS uses MDMA to treat post-traumatic stress disorder, PTSD, in veterans and first responders in Phase 3 clinical trials seeking FDA approval. Academic institutions like Johns Hopkins are testing psilocybin as a treatment for existential anxiety in life-threatening cancer. The popularity of ketamine clinics grew rapidly. However, many of the clinics directing physicians viewed ketamine simply as a pharmacological tool without context or appreciation for its psychedelic properties. They administered the treatment multiple times a week, following the protocol of the well-controlled clinical trials, using sub-anesthetic doses for treatment-resistant depression. Since then, the industry has become psychedelically informed. Knowledge that the impact of ketamine is deeply influenced by the set and setting of the experience, and awareness that this directly affects the treatment's effectiveness and durability, how long the relief lasts, is now prevalent. Companies like Field Trip Health and Nushama have created aspirational environments in which patients experience the therapy. But these come at a cost unattainable to many, as insurance reimbursement is atypical and most patients pay cash. From synthesis as an anesthetic to acceptance as a psychiatric intervention by the National Institute of Mental Health and American Psychiatric Association, ketamine's value continues to expand. Its latest value being that of facilitating the birth of a true art form, ketamine-assisted psychotherapy, CAP. This use of ketamine in no way invalidates its medical application. Its neurobiological effects are indeed powerful and have given researchers incredible insights into the mechanisms of depression. Ronald Duman et al. Of Yale Psychiatry have published extensively on ketamine's ability to induce neuroplasticity, reduce neuroinflammation, and modulate network activity to treat depression, anxiety, and PTSD. Ketamine's story took another pivot during the COVID-19 pandemic. In the face of a severe mental health and supply chain crisis, regulators responded by legislating a waiver to the Ryan Haight Act. This well-intentioned regulation prohibited the prescription of controlled substances through telemedicine, in an attempt to maintain a standard of care when dealing with opiates for pain management. But the law's application to Schedule III controlled substances included ketamine. Due to the public health emergency waiver, telemedicine prescriptions of ketamine became possible. Companies like MindBloom and My Ketamine Home emerged to fill the void of treating patients in the comfort and accessibility of their homes, with prescriptions of compounded tablets of ketamine mailed to their homes and self-administered after appropriate education and supervision. As of late 2022, 2 large studies of those patients have demonstrated that ketamine can indeed be safely prescribed through telemedicine and self-administered at home, while still being highly effective in treating treatment-resistant depression and anxiety. New Life Health, a public benefits corporation, acquired My Ketamine Home in 2021 and has treated several thousand patients using its HIPAA-compliant digital platform, which tracks data on each experience. The platform also curates playlists to accompany a patient's intention and monitors their depression, anxiety, and PTSD symptoms.
Sample complete. Ready to continue?